Hi, my name is Dr. James O'Brien. I am a neuro-ophthalmologist in Oklahoma City, and in this video I will briefly discuss thyroid eye disease. Thyroid eye disease, or TED, is an autoimmune disease that causes inflammation and swelling of the eye socket tissues behind and around the eyes. This may involve the eyelids, muscles of eye movement, and eye socket fat. Patients with thyroid eye disease may have thyroid hormones that are too high, too low, or sometimes they can even be normal. Signs and symptoms of thyroid eye disease include bulging forward of the eyes, swelling and redness of the eyes or eyelids, eyelid retraction, which causes the eyes to appear more open than normal, double vision due to eye muscle swelling, and blurry vision. Blurry vision is most often due to dry eyes, however, it can rarely be due to optic nerve compression from eye socket swelling. The diagnosis of thyroid eye disease is based primarily on clinical findings, but it can be supplemented by blood tests such as thyroid hormone levels or checking for certain thyroid antibodies. Imaging of the eye sockets can also be helpful. As seen in this figure, there is a relatively normal size eye muscle on the left indicated by the green arrow, whereas a muscle affected by thyroid eye disease becomes enlarged and swollen as indicated by the red arrow. The treatment of thyroid eye disease is somewhat complex and specific to each patient individually. However, it will generally involve an endocrinologist as well as a thyroid eye disease specialist, such as a neuro-ophthalmologist. All patients should undergo evaluation for thyroid hormone levels and ensure that they are controlled. And all patients should stop smoking, as this is a risk factor for worse outcomes and worse treatment responses. Patients who have a need for dry eye treatment can use products such as artificial tears. Patients with visual blurring or double vision may require glasses, sometimes with prisms. Patients with more moderate to severe eye socket inflammation may require treatment with systemic medications such as steroids, teprotumumab, or sometimes others. And lastly, sometimes surgery is necessary for patients with very severe disease or for residual after effects of the disease. This may include eye socket surgery, eye realignment surgery, or eyelid repositioning surgery. Thyroid eye disease generally goes through an active phase, which can last for months to years before it finally becomes inactive. During this period of time, it can leave behind permanent changes to the eyes. As noted before, smoking is a risk factor for worse outcomes and worse treatment responses. And because of the potential for permanent changes, it is recommended that patients be evaluated promptly if there is a concern for thyroid eye disease. You can find additional patient information brochures about thyroid eye disease as well as other disorders at www.nanosweb.org/patients. Thank you.